Right, Minister, I think we're right.
Well, good.
Yeah.
Well, good morning, Queensland. What we have seen with Omicron in this second wave is, as we expected, the case numbers are starting to come down in the community, which is great news, but we are seeing the tail end lag in our hospital system and across our health workforce. So in the last 24 hours, we're now reporting 572 COVID patients across our public and private hospitals, and that's the highest we have seen in this second wave of Omicron. But the good news is we are seeing a decline in the number of children being reported positive. Just 2 weeks ago, we had 3,121 children, and today's numbers are down to 997. So that's really positive news. It's further evidence that we are coming off the wave, but we are seeing, of course, those people who are unwell coming into the hospital system. And we have also recorded 3,416 health workers and 195 Queensland Ambulance Service operational staff who are furloughed as well. So we know that with those COVID numbers in our hospitals, as well as our staff who are isolating or quarantining, that is putting pressure on the system. However, what we saw yesterday was historic. With the number of 000 calls that came through for Queensland's ambulance service, it was the fourth highest on record, and the previous three were in the middle of the first wave of Omicron. So this is quite unprecedented to see those figures. And in fact, it was a 32% increase in 000 calls to Queensland Ambulance Service. That actually initiated Telstra to contact both Queensland and New South Wales, who are also experiencing increased demand of their 000 with their ambulance services. And Telstra initiated a pre-approved recorded voice message advising people that there were a high demand, and that if it was a health issue and it was not an emergency, that they should ring 13 Health instead. Telstra does this when they consider that there could be extra demand and that it's actually potentially putting at risk people also trying to get through to police and to fire and emergency services. Now, I'm being advised this morning that Telstra has never initiated this pre-approved call for the Queensland Ambulance Service in Queensland before. That is the extent of this demand. It has been done in New South Wales before, and Victoria has seen this come and go a number of times over the past months, but this is certainly unique for Queensland in relation to the QAS. I want to thank our paramedics and our health staff who tried to manage it as best they could yesterday. It was extraordinary. No one wants to see the sort of lines that we saw outside of our hospitals with the ambulances and the delays that were incurred. It is starting to come down today, so that is really good news. But I have the Ambulance Commissioner here today who has told me again this morning that some of those calls also saw a significant increase in code ones. So it was not only a very large increase in 000 calls, but an increase in those most serious of calls needing emergency care. So we will continue to work with QAS to manage this, but I am glad that that pre-approved call system at Telstra came off just after 10 o'clock last night, and we are starting to see an easing of some of those pressures. But it was certainly an extraordinary time on top of hitting what I hope are some of our peak numbers as far as furloughed staff and hospital beds for COVID. But it is important, I do say to people, if it is an emergency and you do need an ambulance, you should still call 000. But if it is not an emergency, do consider calling 13 Health to seek advice first, just so we're not putting extra pressure on our 000 system and our operational staff who are doing their absolute best to manage these calls. I'll now hand over to the Commissioner and then take some questions.
Thank you, Minister, and good morning, everybody. Firstly, can I just reiterate what the Minister has just said about
our hard-working QAS staff and their colleagues within the emergency departments that worked tirelessly yesterday to deal with what was for sure a very demanding demand for service for Queensland Ambulance Service, and largely not something we've seen before outside of the Omicron wave in January of this year. Very high numbers of 000 calls, as the Minister said. That converted for us to approximately 400 additional Code 1, so the highest emergency coding for us, another 400 of those in the day, up from an average of around about 1,150 to 1,559 yesterday. So through our triaging methods and through staying in contact with our patients, I'm pleased to say that the patients that of the highest acuity did get a timely response from ambulance yesterday, but for sure some of those lower acuity patients that the Minister's mentioned did wait longer than we would want them to. We do maintain contact with them. We do provide advice to them about options, including a HCC, as the Minister said. We would rather a more timely response, but when the chips are down, we'll always prioritise those highest emergencies.
Minister, what were the calls that you were getting? Were they majority COVID?
Look, we're trying to analyse. We're still to get a breakdown of what the calls were. It was interesting, New South Wales were also experiencing high demand, but as we just heard from the Commissioner, an extra 400 Code 1s when the average is around 1,100, that's almost a 40% increase, which is quite extraordinary, which obviously takes a lot of ambulances and paramedics off the road when they need to get to the hospitals.
Were you surprised about that Telstra thing? I mean, obviously, did they call you at all?
So the only other time I did get a call last night advising me that Telstra had initiated this pre-record. The only other time I'm aware of that is in the first wave of Omicron in January, when every state was facing that, or the majority of states, there was a nationally pre-approved recording that was put in place for a number of days. I think it might have even been a couple of weeks, just to, and I remember the Commonwealth announcing that, just to try to manage all those 000 calls, because we know at that point, as soon as someone saw a positive line on their rapid antigen test, they were calling QAS.
Yeah, and we didn't get that. We didn't get that in that first wave. This is the first time, to your knowledge.
Yeah, well, as I say, it was a national pre-record. This is the first time that Queensland, as a separate jurisdiction, has had Telstra initiate this. So I'll be really interested to see the data and what those calls were, the nature of those calls. But it is really interesting. I don't think anyone can explain why we saw a 40% jump in Code 1s. And I've seen that as I've travelled around the state sometimes. I'll walk into an ambulance service and they'll say, we had a 30% increase in Code 1s yesterday. Can't tell you why. We just had a lot of heart attacks and chest pains and trouble breathing, respiratory issues. Sometimes you can't explain why those things happen, but unfortunately.
Do you have any theories or any idea as to what could have been that exacerbating factor?
No, we don't have that information yet, but what I do know, and I'm hearing some interjections on the side, is that vaccines actually help people stay out of hospital, not put them in hospital.
Does it concern you that Telstra initiated it?
No, not at all. That's their job. So they manage the telecommunication system and can see the volume of 000 across the country. So it is their job and to manage that, and they were the ones who said they're concerned there was so much demand for the ambulance services that it could impede people trying to call for police and for fire and emergency, and that's why they initiated a specific messaging around health, because it wasn't just normal 000s or any 000s, it was specifically 000 for ambulance services that had the high demand. So they wanted to make sure that people who didn't really need an ambulance, that it wasn't an emergency, were redirected to 13 Health. And I'm glad that they do that.
How long ago were other people waiting for it? So how long were the Code 1s waiting for, and then everyone else who wasn't?
So my understanding is the response time for Code 1s was about 8.9 minutes. So we're still certainly within our times. The 90%, I think, was around 19 minutes for responses. So obviously at ramps they were waiting much longer because of... I haven't got the breakdown, but I suspect so.
The opposition was using Queensland You pointed out that some people waiting in excess of 8 hours. What is being done to alleviate those pressures that we are seeing in the health system?
And look, despite Omicron and what we have faced since Christmas, we had started to see at the start of this year some easing off of those pressures and improved patient off stretcher time. Now, not everywhere, and we're looking at why was it that some areas were doing better than others, but certainly we were seeing some improvements in areas around the state. But we're seeing those pressures build back up as we've gone into this second wave. It's going to be really difficult as we invest in opening up more beds. Those beds are being taken up with COVID patients, and the Commissioner and I were just talking this morning that just about all of the extra beds we put on with the Care for Queensland funding are equivalent to the number of COVID beds that are being taken up right now by COVID positive patients. So it just shows the pressure on the system, and we will continue to work to ease those pressures. We're working with internal stakeholders, with the hospital and health service, but also with external stakeholders, and trying to look at how we streamline some of those pathways through the health system, as well as getting more beds online, as well as getting other services out of our hospital systems, which is what the satellite hospital's about, so we can free up floors to put more beds in.
Minister, just on, we talk about that furloughed staff, is it again time to start looking at those close contact restrictions that are in place? I know that it's one of those settings.
So AHPPC have already indicated potential easing of the quarantine requirements around close contacts, but they said when we come off this wave, so we're waiting for them to come back to us and say we think we're through the peak across the jurisdictions, and it's time to move to some of those other recommendations they were talking about, but I don't think they've finalised exactly what that would look like. I do believe that it should be a national decision. I think all states should move to that so there isn't confusion and there isn't inconsistencies across borders.
Victoria is doing something similar today with the airport staff and things like that.
Look, we've already done that as far as critical essential workers. So we've already identified critical industries and have allowed them to bring staff back. So in that regard, health workers are already being brought back, but very, very cautiously. We still have the majority of staff away because remember, if you choose to bring someone back into the workplace, you're putting the staff and the patients more at risk of getting COVID. So we've got to do it very carefully. So we're in the middle of a press conference here, so I'm happy to talk to you afterwards.
Just on the ramping issues though, so this is the 4th time since what we've had, like say, this volumes of calls. Obviously yesterday was extraordinary. What confidence can people have as we head into winter? COVID isn't going, we've had additional health officers say that. Why can't our hospitals though deal with days like this? What are you going to do to better prepare them?
Look, I don't know any hospital system in the country that can prepare for a 30 to 40% increase on a single given day. There'll always be pressures, significant pressures when those types of days happen. This is only the 4th time ever in recorded history with the Queensland Ambulance Service that we've seen this sort of figures. Since, ever. As far as recorded, since we've been collecting recorded data, as far as O calls, this is the 4th highest ever recorded. Not just since COVID, ever recorded. So it's hard to plan for those sort of escalations. But as far as winter, certainly we are working both with the private sector and our public hospital system about preparing for winter. It's why we are encouraging people, and parents particularly, to make sure their kids are vaccinated before winter comes, and for people to get their boosters. And of course, we know that TGA have now approved a 4th booster for people over 65, and Aboriginal and Torres Strait Islander people over 50, and aged care residents and people who are immunocompromised. But also, I'm aware that we've got 120 extra recruits with Queensland Ambulance Service coming on in May in 2 tranches. So we've got 60 at the start of May and another 60 near the end of May coming on. So that's another 120, and that's really called the winter surge. So that is actually, these recruits are being brought on to deal with what we expect to happen in winter, which is extra demand.
So the previous 3 times we had the roll up in Queensland, when did they
I believe it was 3 consecutive days in January. I can get the exact dates, but 3 consecutive days in January at the absolute peak of the first wave of Omicron.
And that, obviously this is yesterday was the busiest compared to those 3 times.
Yeah.
That's still 4 times where you've had this huge demand.
This year, absolutely.
Only in April.
Yeah. Yeah.
I mean, surely there's some, that's worrying, isn't it?
Oh, look, it is. But again, as far as, for example, Telstra initiate that pre-approved calling system, this is the first time ever for us. New South Wales has had this occur, at least a couple of times as I'm aware. Victoria's had this a number of times over the last few months. So the fact that we've been able to avoid that, and this is the first instance that Telstra's had to initiate that pre-approved recording, I think is a good thing. That shows that our system is managing as best we can. But these are very, very unique circumstances, what we saw yesterday. But, as I've said, we continue to have pressure on the health system. There is a federal election right now. I would welcome anyone standing up who is running federally and saying they'll match funding 50-50. Remove the cap and match real funding 50-50. That's what we need to see, because we need investment from the Commonwealth, but we also need help with our GPs. And if there was a GP, an affordable, accessible GP in every single town in Queensland, it would fundamentally change the pressure on our public health system. No doubt. I've just spent all of last week travelling in northwest Queensland, and the number one issue is the lack of doctors and GPs in the community, and that is why so many people are turning to the health system, and that's why so many people are ending with chronic illness and ending up to spend more time in a hospital system when they shouldn't, because it is preventable.
Thanks, guys. We're going to go. Very last one.
Sure.
Yeah. Commissioner, did you have to take any emergency action yesterday or do anything out of the norm to deal with this?
Well, yes, we have well-established sort of escalation plans that were refined during our COVID period, and it does include a range of actions, including bringing in additional staff, additional supervision. We have a state operations centre that runs 24/7 to have that oversight, that interface with our broader health system, with our colleagues, all about ensuring we can do as much as we possibly can to return ambulances to the community. In addition to that, what we have done is put additional medical oversight into our communication centres so that there is a doctor or a trained critical care paramedic reviewing those patients that are waiting, ensuring that they're safe to wait, and those that need to be upgraded and an ambulance sent faster. We always do that.
Thanks, guys. We've got to go. Thank you.